Hi, I'm Dr. Rudy Cashman. I've been a neurosurgeon here in Fort Wayne, Indiana for about 40 years, but I'm only 39 years old. Part of the medical conditions that a neurosurgeon treats, besides brain tumors, is vascular disease, strokes. But when does the disease really begin? When we start having vascular disease, at what age? I'm sorry to say, it starts at a very young age. They're starting to find vascular changes in children at age 4, as a teenager. And that's the reason really for tonight's discussion and lecture about the diet that children should be eating. I've written a book called The Secrets of the Non-Diet for Adults, but I'm also finishing a book called The Secret of the Non-Diet for Children. So let us begin. Let's look at the problem a little bit, the state of the children's health. 60% of adults are overweight in this country, a very serious problem. 32% of children are overweight, 32%. Would you believe it? Obesity is the most common pediatric disease. Pediatricians need to be wellness doctors. Age 2 to 5, we have an increase in obesity from 5 to 13.9%. Overall, there has been a 300% increase in overweight and obesity in the United States over the last 15 years. I mean, really dramatic statistics. The definition of overweight and obesity, I mean, what makes you overweight? What makes you obese? What are the measurements that we normally use? Body mass index is what we generally use for adults and for children. That's based on your height and your weight. It can be pounds or in kilograms. It's based on a graph. There's a different graph for children, a different graph for adults. Adult BMI, then what are the normal ranges? 25 is normal and under. 25 and under is normal. Mine is about 24. And 25 to 30 is overweight. 30 to 35 is obese. Over 40 is morbidly obese. I mean, you're heading for big-time trouble. Evaluating children. How should a child be evaluated? If you take a child to a family physician, for example, one of the first things the nurses should be doing is measuring the height and weight of the child and then keep a BMI chart on the child as it grows over the years, frankly, starting at a very young age. Starting, say, at age 2, we should need to start looking at the BMI or even before. Waist measurement is another method. There are no good studies or graphs you can refer to on waist measurements, but generally it would be that the abdominal measurement should not be larger, taken at the umbilicus, larger than the hip measurement or the chest measurement done at the nipple level. If it's larger than that, they'll be overweight. There are countries like Brazil where they've studied it extensively. I know a pediatrician. I said, how do you judge the weight of a child? I talked to one, and he said, I look at them. Well, that's just not good enough as far as I'm concerned. I have another one I thought was kind of interesting. He has a child get on the floor and do push-ups, find out what kind of shape they're in. I thought that's interesting. But the BMI is really the standard of measurement of our in a child's weight. Evaluating children, if you're in the 85th percentile compared to other children, you're overweight. If you're the 90th percentile, you are obese. I unfortunately see a lot of obese children today. Recently, I saw one at Parkview Hospital had dove into a pool, broke his neck, was paralyzed arms and legs. I would say the child weighed 280 pounds. And the first thing he said to me,